Hello, everyone. So let's review a question that was sent to me, and this person reached out to me on Facebook. So, of course, yours truly, Dr. Fryson, and this question is directly related to my history and my time in the clinical laboratory. So, for those of you who don't know, my very first degree, technically second degree, was as a clinical laboratory scientist. And I worked in that industry in all areas. And of course, I have a lot of expertise in that industry. I've opened labs in different parts of Florida and done a lot of laboratory work, right? So, of course, that's one of my degrees. So, of course, those of you who know me from my other degrees, your girl likes learning. All right. So here we go. I'm going to share with you. Let me share my screen so you can see the actual question. Okay. So you should be able to see my screen now. And I did get this. This is the original, but I just copied this from Facebook Messenger. So, and this is what the person said, that they had a full panel of blood work done on Monday. This was last week, and then they went back for the results, and everything was fine except for one thing. And of course, for those of you who know me with my nutrition degree and my herbalism, I can help with that cholesterol issue. But anyway, they had an STD panel and they had to wait a couple of days. So then they got a call from the doctors saying that the HIV came back positive. They are sexually active with one partner. And before then, they were celibate and they had laboratory STD results done at a previous time some years ago. Everything was normal. Now, the person had Lyme disease in April of this year, and they took doxycycline for 28 days, right? And then they said they have arthritis, okay. And so the thing is that could this HIV test be a false positive? As you can see at the bottom, they go back on Friday to do blood work follow-up, but the doctor said they probably have it, right? So that's where we are with them contacting me. So now you guys also know by now that I'm a patient advocate. I do patient advocacy work as well. So let's talk about what this person is dealing with, starting with a couple of things. Being one, they got an HIV result and the doctor said you probably have it. Not the ideal thing for a doctor to say without having confirmation. So the person was asking me about the fact that the doctor gave them the results and need to retest it. Well, there's a couple of reasons for that. One, if the doctor sent it out for testing, a screening test would have been done. Normally, if a screening test is positive, then it is sent out for confirmation, right? So, and the confirmation is a far more specific and sensitive type test. And I do know, because I traveled the United States, and I don't know exactly where this person is because they didn't tell me, but I do know that there are a few places that are not automatically ordering the HIV confirmation for various reasons. I'm a Florida girl, so I did not know that happened, but outside of Florida, I have seen that happen. Now, this could be one of those places, but let's assume that it isn't. The normal process for HIV testing is a sample is collected from a person. The person is delivered to the laboratory. It is sent to the area where the HIV testing is going to be performed. And there could be a mix-up that happened. And when someone drew her blood work, they could have mislabeled her sample. And the lab could have gotten the wrong sample. That's pre-analytical, right? Also, when the sample arrived in the laboratory, when we do the testing in the laboratory, we have to take from the primary tube and test in a different way. They could have mislabeled something along that spot. So, could the person have gotten a false positive from that aspect? It's possible. Not highly likely, because of the measures that are in place now within the laboratory. So that may not be the case, but it's still possible. The second thing is the person wanted to know about, could this be a false positive? And they mentioned a key. They had Lyme disease in April. Now, the HIV test is an antigen antibody test. And that antigen antibody test is, of course, based on your T cells and your B cells. All antibody tests pretty much are based on T cells and B cells in general, right? Won't get into the exceptions. Antibodies are produced, your body has a response to something, an antigen, and it produces antibodies. When we do the HIV test, we're looking for those types of antibodies. The problem is that the certain antibodies look alike. They are very similar. So they can have what's called cross-reactivity in testing. So there could be, if you're testing for Lyme disease and a person is HIV positive, there could be some cross-reactivity with the Lyme disease test. That's just an example. In this case, HIV, one of the things that definitely interferes with the test is documented in all the white papers, and it's documented by the testing that was done through that's submitted to FDA, Food and Drug Administration, is that Lyme disease and autoimmune disorders can cause false positives in HIV testing. Does this always happen? No. Is it possible? Yes. And the fact that she just had Lyme disease in April, it is a possibility that she still has Lyme disease, although she took medication for it. The medication does not read the instructions. It is not guaranteed to eradicate your Lyme disease in 28 days. Okay? So the person could have, like for myself, lupus. Lupus is one of the diseases that can give a false positive HIV result. Thankfully, I have not had a false positive HIV result. However, it is on the list of diseases that has the potential to yield a false positive result. However, the process for HIV testing is multi-layered. So you get the screening test. If the screening test is positive, you send it out for confirmation. When you send it out for confirmation, some labs can do the confirmation in-house, but most labs now send it out to a larger lab to do the confirmation. So when you send it for confirmation, there's levels that take place. The results could come back and they could be positive, and then that means you have two positives, and depends on the state you're in, that would label you as HIV positive. Or it could come back as inconclusive, and your doctor could say you have to wait and come back later. In this case of a person with Lyme disease, if it comes back inconclusive, it could be because of the Lyme disease, and the person will have to wait until the Lyme disease has been resolved before having the HIV testing done again, right? And then the other thing is that it can come back as negative. If the confirmation test is negative, that is like the Bible, right? That's the test that you go by, which means the person would be deemed as HIV negative. Most likely the recommendation would be for them to wait 6 months and be tested again. Now, back in the day when we were first doing HIV testing, that was the standard. You waited 6 months. Now, with the way things are and the way doctors do things, you might only wait 3 months. It just depends on the doctor. Now, there's a couple of caveats for this. This person did not indicate that syphilis, which is part of the STD panel, was positive. And for me, that's rather interesting, because I remember there was a time when I was working in a laboratory and I worked transfusion medicine as well as serology. Serology is the area where you do these types of testings. The STD panel, so your syphilis, which is your RPR, your VDRL, and you also do the test for like autoimmune disorders like your anti-nuclear antibodies, your hepatitis, all of those different tests, right? And there's some cross-reactivity that occurs with those as well, right? So one day when I went in to work, I was called over to repeat testing that another person had performed. And I, of course, asked questions because that's me. And I found out that, of course, the patient was a pregnant woman at this facility who had come back as positive for syphilis and positive for HIV. This was in the very early 90s, right? Like 1993. And at that time, this was like, oh my God, it's a big deal. And so, of course, there was a root cause analysis being done, and they wanted to make sure the person was actually positive before they took any actions as far as, because the baby could be impacted. So, in that case, the procedure, the process, the practice was you would repeat not just that person's sample, but every sample that had been performed in the previous run by the previous person. And we're called technologists. So the previous tech had run their 12 samples, and so I came in to run the 12 samples again. And when I repeated the 12 samples again, all of the previous patients' results lined up, right? Except for this patient's result. And what that said to me was that this wasn't a case of they switched up the tubes or something, because it was a lot more manual back then. Now, this person's results, the syphilis for me, this time the result I got was negative. Previous it was positive. And then the person's HIV test results that I got was inconclusive. And this is the screening. And then the screening has to get sent out for the confirmation. And at that time, it was a little different than now. It wasn't an automatic that you send it out for confirmation. It was more steps to it, right? We're talking the 90s here. So this meant that according to my results, the person's HIV was negative. So the previous person had positive, I had a negative. The RPR, the previous person had a positive, and I had a negative. But my negative result was only because of the way the reaction looked. It really would have prompted us to repeat it as an inconclusive, because it wasn't a true negative. There's layers to that. So what this does is it requires a third set of testing and a send out. And at that point, back in those days, we used to have to get permission to send it out. We sent it out. It came back as negative and negative. So the HIV was negative, the RPR was negative. I was part of the root cause analysis panel, where they go through all the steps of how the result could have come about, and things of that nature. And they give the history of the patient, and it turns out the patient had an autoimmune disorder that the patient was dealing with, and the doctors already considered the patient high risk. And at that time, the medical director over the laboratory concluded that it wasn't a laboratory error, it was an error in the sense that it was a false positive due to the autoimmune disorder. Now, things move a lot faster today. We don't have all those steps. It's a lot easier to get to the answer. So that's why I say it's important to have the test repeated, because mistakes still can be made, but also because when you have things going on such as autoimmune conditions, you always need to question results that you receive, because these antibodies do have the potential to have cross-reactivity. Now, going back to the person who sent me this question, this person said also that their partner is going to be tested, which is important. But I have to give you guys the caveat. You can have HIV and it can be dormant, and that means it's not active, it's not showing up, it's at a low level. So a person may not be showing up as positive. This person could have had HIV years ago and it just now showed up, or this could be just the result of the fact that they had Lyme disease and it's cross-reactivity. Okay? Now, go past that, and I want to remind people, because I know HIV is super scary, and I do want to remind people that there's been a lot of advancements in the treatment for HIV, to where there are people who are HIV positive, but their viral load is so low that technically they can't transmit HIV to others. So if you just so happen to be a person that's recently diagnosed with HIV, I would encourage you to go through the different treatment methods or whatever that your medical team deem is appropriate, and make sure you take care of yourself and get to hopefully the point of where you cannot transmit it. And always practice safe sex. That definitely helps. Now, outside of that, this person also asked me if they have a false positive result, is this something that will allow them to sue their healthcare provider, especially since the doctor said you probably have it. My initial response as a non-lawyer is no. There was no treatment done to this person, so in my mind there's nothing that would cause her to really have a grievance outside of the fact that she had some mental anguish. They did say, hey, we're going to repeat this, and now if she goes through the battery of repeating and then things come out negative or positive or whatever, she can deal with that as she will. I'm not a lawyer, so I can't say. I can say that as a laboratorian, I was called to testify about some laboratory testing that was performed. And in that case, a lawsuit was being put forth based on partially the results that the person had received. But that was in pathology, and that was, cancer diagnosis. So, not getting a cancer diagnosis on time and then having a stage 4 cancer and limited time to live is definitely something I've seen people sue over. And in the lab, we've had to save samples and send samples out to places if we had them that were part of lawsuits. Okay, so not everything is a lawsuit. All right. My final thing that I want to leave you with is that I am Dr. Fryson, and I am a shaman and a scientist. And on both sides of the scale, included in between that, all my herbalism and my nutrition and all those other degrees and all those therapies and all that kind of degrees that I have. And I am also a patient advocate. So if you need patient advocacy services, you can reach out to me. My contact information will be at the end of this presentation or this question and answer session. Okay? And take care of yourself to the best you can. Thank you to the person who sent me the question, and I really hope all turns out well for you. Okay? Bye.